got a history, and he had a big hole in his head, and he was deaf on one side, and his balance was lousy. And I said, what happened to you? And he said, well, he had an acoustic neuroma, which is a benign tumor of the hearing ear on the right side. And he went to a hospital in Manhattan, and he had surgery on that acoustic neuroma, and they removed it, we hope. And then he was left unable to walk because his balance nerve was taken, and he was left totally deaf on that side because they must have cut the nerve. And apparently he heard about us. He heard about us through the grapevine, actually, that we have the largest experience in the world treating acoustic neuromas. He was really sorry and sad, he said, that he didn't come to us back then. Our experience is totally different for acoustic neuroma treatment. We have the largest experience in the world treating acoustic neuromas. We were the first in New York to treat brain tumors with radiosurgery and fractionated radiosurgery. Radiosurgery means we pinpoint exactly where the tumor is. It can be benign, like acoustic neuroma, or meningioma, or pituitary tumors, or it can be malignant, like glioblastomas, or metastasis, or astrocytomas. But nevertheless, radiosurgery allows us to hit the tumor non-invasively without the cutting and the bleeding. And so, for example, an acoustic neuroma, there would have been no surgery. There would have been no hole in his head, which is about the size of a golf ball. I can tell you that most likely 98% chance he would have had hearing, unlike being deaf. And because that tumor affects the balance and often causes balance problems, actually about 70% of our patients have improved balance. I want to take this call. Good evening. You're on the radio. It's Dr. Lederman.
Oh, sorry. I tried to call contact with Dr. Eisen. This is Rafael Mato. How are you doing?
You're on the radio. You can call Dr. Eisen on his cell phone, okay?
Okay.
Okay, thank you. Good night. Buenas noches. That's the beautiful thing about us. We give our patients our cell phone numbers so they can call us day or night. We don't believe in machines, our students, or the usual thing. We believe that patients want to speak to their doctor. So as you can see there, our patients call and give him our cell phone number, and he's going to call Dr. Eisen's cell phone number and speak to him at 9:30 Sunday night, which is perfectly fine with us. So anyway, we're talking about acoustic neuromas and benign brain tumors. The whole idea of treating tumors with radiosurgery is to avoid surgery, to avoid the deformation of the skull, to avoid the loss of hearing, the loss of balance, and sometimes even the loss of life. Brain surgery often has a mortality rate of about 1% and a morbidity, meaning stroke or complication rate of about 5%. So for this man, unfortunately, he heard about us 5 years too late, but he came to us for the big mass on the shoulder, and we will get that diagnosed and report back to you what it is. For those of you who have heard about acoustic neuromas or want more information, we actually have a booklet that we'll send out at no charge about acoustic neuromas and brain tumors in a DVD. For those of you who have unilateral hearing loss, if you have hearing loss in only one ear, that may well be the sign of an acoustic neuroma. Sometimes people can't hear on the phone on one ear, but they hear in the other ear. That's also a sign. There are some patients, a few, who have these tumors in both ears, which is a different disease. It's called neurofibromatosis 2, and we also treat patients with neurofibromatosis 2. They have usually bilateral acoustic neuromas and multiple brain tumors. So, again, if you have questions, you're welcome to call us at 800-321-0710. I would like to take this call from Mario in Brooklyn. Good evening.
Good evening, Dr. Lederman.
How are you tonight?
Okay. It's a pleasure to speak to you again.
Mutual.
I just have a general question.
Okay.
I'm very well aware of your position on chemotherapy. How does radiotherapy stand up to CyberKnife, NanoKnife, and proton therapy? And I'll take my question off the air, sir.
Okay. Well, first of all, I'm a medical oncologist. I'm a board-certified medical oncologist. So I believe in chemotherapy if there's data to use chemotherapy. Sometimes there's not data, and when it's given for reasons that there's no data, then you have to wonder if it should be given. We just saw a patient a couple of days ago who's moribund, paralyzed, in a hospital. He walked in a hospital 3 weeks ago. He's now paralyzed. He's at death's door, and the doctors want to give him more chemo, even though he's had years of chemo. So in those cases, I'm not a big fan of chemotherapy. I'm a big fan if there's data that shows and if there's chances of a patient getting better. Now, you asked several questions. I want to address those questions as best I can. The radiotherapy is just a general name for the use of radiation to treat people. So it can be any kind of radiotherapy. Radiotherapy is a contraction of two words, radio for radiation and therapy for therapy. Generally, it's a term that's used for standard or generalized radiation. And standard radiation I usually compare to a plum in a bread box. And traditionally, if you had a cancer in your body, the body would get radiated like a bread box, like the size of a bread box. So large areas of your body would be radiated to try to hit the cancer accurately. Furthermore, because large areas of the body were radiated with standard radiation, small treatments were given every day for 4 weeks, 5 weeks, 6 weeks, 7 weeks of treatment for most all diseases. Now, radiating the healthy tissues, like if you have a lung cancer and you radiate the lung, harms the lung. If you have a pancreas cancer and you're giving standard radiation, well, you're radiating the kidneys, the spleen, the intestines, the spine to get to the pancreas cancer. Radiosurgery allows us to focus in and aim at the cancer. And because we can focus in and aim more accurately, we can give treatment more intensely, and therefore we can give fewer treatments. So the patient wins by getting the healthy tissues in general out of the way of the full dose. They get more focused treatment. They get higher doses, which is biologically more effective, and therefore they get better results. And some will say, for lung cancers, for example, our success rate is about 90% to control the cancer, compared to about 50% with standard radiation. So there may be a very big difference in the outcome, and plus you're getting more treatment in less time that's biologically more effective. Now there's other methods of treatment, there's other machines, and CyberKnife was invented by a man that I consider a friend, Dave Adler, and he was a neurosurgeon, he is a neurosurgeon, and he tried to develop a machine that would mimic pretty much what we do. Well, our machine and our technique stabilizes the body in a particular position so we know where the cancer is. CyberKnife takes multiple x-rays of the patient and then tries to line up the CyberKnife with those x-rays and uses a computer. So there's much more uncertainty with a CyberKnife. The treatment is much longer because of the mechanism of setting up the patient, and there's much less track record. We were the first ones in New York, the first ones in America, the first ones in the Western Hemisphere to use body stereotactic radiosurgery. And we've treated about 20,000 patients. So coming to us means not only do you have us, but you have our experience, the stability of our system, and an accuracy that is excellent. And we have data. We've looked at these patients, we've treated them and followed them up, and we do that for all our patients. So having experience means a lot. I often tell people, if you have the same paintbrush as Michelangelo, doesn't mean that you're going to be painting like Michelangelo. And Lance Armstrong, I know many people consider him discredited because of his doping, but one of his books was entitled, "It's Not About the Bike." Someone has to sit on that seat and pedal it up and down the mountains. And it probably didn't matter if he was using a Trek bike or X bike. Someone, whether it was him or someone else, has to do the work. And so, therefore, I believe that experience matters, the team matters, how they're devoted to a technology matters, the leadership position, the fact we presented papers from around the world for 20 years about our work, the fact that we were the first ones in the Western Hemisphere with body radiosurgery, tells you a lot about how we believe towards this technology. So again, if you have questions about it, we have a booklet, and we'll send that out to you at no charge. Just give us a call during the week at our office phone number, which is 212-CHOICES, 212-246-4237. And by the way, we're here live, and I see Mike and Noah want to get busy on the phones. So you can call WOR Studio at 800-321-0710, 800-321-0710, because we want Mike and Noah to be busy.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. And we're back talking about more cases. We're back live, taking your calls. You're welcome to call us at 800-321-0710 if you wish. We had a patient that went to another facility for prostate cancer, and he's, for some reason, through a friend and a friend, he's relaying all the information to us. And this is the man that had prostate brachytherapy at another hospital, which charged him, and he collected $55,000 for prostate brachytherapy. And on the same day, we treated a patient, and we got $4,000. So it cost him more than 12 times the amount for the same procedure on the same day. The only difference I can see is that our patient came in at 7 o'clock in the morning and got his prostate brachytherapy and left us at 8:45 to go to work. And this man, who scheduled at 7 o'clock at another hospital, he didn't get his procedure done until 4 o'clock in the afternoon. He couldn't eat all day. He was walking around the hospital with his hiney hanging out. And now he's got back pain. He went back to that hospital, went to the emergency room last week, and he was so upset. He went to the emergency room. He saw multiple doctors, and he was shocked. No one examined him. He saw multiple doctors. There were student doctors and attending doctors and others. He went to the emergency room at this very prominent hospital, and no one examined.